Hello everyone. In this study, we are conducting a comparative efficacy and safety analysis of Cilta-Cel versus Ide-Cel in real-world relapsed refractory multiple myeloma patient, and this is a retrospective intention to treat analysis. Chimeric antigen receptor T-cell or CAR T-cell therapy has become a significant advancement for treating relapsed refractory multiple myeloma patients. Carvykti or Cilta-Cel and Abecma or Ide-Cel are two CAR T therapies targeting B-cell maturation antigen or BCMA in relapsed refractory multiple myeloma. Both therapies have shown promising results in clinical trials, but limited real-world comparative data exists. The objective of this study is to compare the clinical efficacy and safety profiles of Carvykti and Abecma in real-world relapsed refractory multiple myeloma patients outside of clinical trial settings. This study was a retrospective cohort study which was conducted at John Trover Cancer Center at Hackensack University Medical Center in New Jersey. For patient selection, we included adults with relapsed refractory multiple myeloma aged between 18 to 70-year-old who underwent CAR T-cell therapy from January 2018 to December 2023. For data collection, we included baseline characteristics, treatment history, therapy response, and adverse events. For safety assessment, we collected data on cytokine release syndrome, CRS, and immune effector cell-associated neurotoxicity syndrome, ICANS, which were graded based on ASTCT criteria. Efficacy outcomes were overall response rate, progression-free survival, and overall survival. For a statistical analysis, intention to treat analysis included all patients who underwent apheresis. Kaplan-Meier method for several analyses were used. For progression-free survival and overall survival, we were calculated them from apheresis date. Cox proportional hazard model also used for prognostic factors analysis in univariate and multivariate settings. Total of 114 patients were included in the study. 50 patients were planned to get Abecma and 64 patients were planned to get Carvykti. The median age of the patient in Abecma cohort was 72.8 years and in Carvykti cohort was 65.3 years. The median prior lines of therapy was 5 in Abecma versus 6 in Carvykti. High-risk FISH profile was comparable across groups. In Abecma was 51.2% and in Carvykti was 51.7%. The extramedullary disease was present in 23.5% of Abecma cohort versus 17.5% in Carvykti patients. The vein-to-vein time was 47 days in Abecma versus 55 days in Carvykti cohort. Regarding efficacy outcomes, the overall response rate was 86% in Carvykti versus 60% in Abecma. For progression-free survival, median not reached for Carvykti versus 7.5 months for Abecma. The overall survival not reached in either group. Extramedullary disease associated with inferior outcomes. Progression-free survival was 4.1 months in patients with extramedullary involvement versus 21.4 in patients without extramedullary involvement. The overall survival was 6.2 months in patients with extramedullary involvement versus not reached for patients without extramedullary involvement. Regarding prognostic factors, Carvykti showed it was a favorable prognostic factor with hazard ratio of 0.28. Extramedullary disease involvement was unfavorable prognostic factor with hazard ratio of 4.3. Regarding safety outcomes, CRS any grade was seen in 82.2% of patients with Abecma versus 67.2% with Carvykti. Grade 3 or higher of CRS was seen in 2.2% with Abecma versus 0% in Carvykti cohort. ICANS any grade was seen in 11.1% with patients who received Abecma versus 12.1% in patients who received Carvykti. Grade 3 or higher ICANS was seen in 2.2% patients who received Abecma versus 3.5% of patients who got Carvykti. In conclusion, in this real-world analysis of relapsed refractory multiple myeloma patients, Carvykti demonstrated superior efficacy with significantly higher overall response rate and longer progression-free survival compared to Abecma, despite differences in baseline characteristics. Extramedullary disease emerged as a significant negative prognostic factor for both progression-free survival and overall survival. Safety profiles were similar between the two CAR-T products, with manageable rates of CRS and ICANS. These findings provide valuable insights into comparative effectiveness and safety of BCMA-targeted CAR-T therapies outside clinical trial settings, and highlight the need for improved strategies for patients with extramedullary disease. Further studies are warranted to confirm these results and explore potential mechanisms underlying observed differences in outcomes. Thank you so much for your attention.